Hey there, Kim Loh here again. We are clearing myths all the time, and there's some other cancer myths in my other videos. I believe you will find one that you are interested. Today, let's reveal the truth as we debunk 5 common brain tumors myths. Myth number 1. Brain tumors are incredibly rare. Ever thought that finding a brain tumor is as rare as discovering a hidden treasure chest? Well, that's not quite true. It's more like discovering a pressure gem just in your own backyard. You might be surprised to know that brain tumors are actually more common than you might think. In the United States alone, in the year 2023, about 24,810 adults will be told they have a primary cancerous brain or spinal cord tumors. Why brain tumors aren't rare? Different types. Brain tumors come in various types, and some are more common than others. While some brain tumors are less frequent, others, like gliomas, are seen more often. Advancements in diagnosis. Improved diagnosis techniques, such as advanced image scans, have made it easier to detect brain tumors, leading to more cases being diagnosed. Awareness matters. As awareness about brain tumors has increased, more people are seeking medical attention when they notice symptoms, which can result in earlier diagnosis. Research and data. Ongoing research help us better understand brain tumors, their causes, and know how to treat them. This knowledge can lead to more accurate diagnosis and improved outcomes. So, don't believe the myth that brain tumors are incredibly rare. While they might not be as common as everyday things, they are certainly not as rare as discovering a hidden treasure chest. Myth number 2. Only children get brain tumors. Have you ever thought that brain tumors are like a special ride in a theme park, only for kids? Well, that's not the case at all. It's more like thinking that playgrounds are just for children, but in reality, brain tumors don't pick favorites based on their age. They can happen to anyone, young or old. Adults can also be affected by brain tumors. In fact, there are an estimated 308,102 cases of brain tumors worldwide in 2020. Why brain tumors aren't only for kids? No age discrimination. Brain tumors can happen to people of all ages, from little kids to grown-up. They don't care how old you are. Different types. There are various types of brain tumors, and while some may be more common in children, others, like glioblastomas, are more frequently seen in adults. So, don't believe the myth that only children get brain tumors. It's crucial for everyone to be aware of their health and seek medical attention if they notice symptoms that concern them. Brain tumors don't discriminate, but early detection and treatment can make a big difference in managing them. Myth number 3. Brain tumors are always fatal. Have you ever thought that dealing with a brain tumor is like being on a never-ending road with no way out? Well, that's not quite true. It's more like believing that every story must have a sad ending. But here's the scope. While brain tumors can be tough, they don't always lead to a sad outcome. Things have gotten better. Survival rates have improved, and brain tumors related deaths have actually gone down over time. In the United States, for example, it's estimated that there will be about 18,990 brain tumors related deaths in 2023. Why brain tumors aren't always fatal? Improved treatments. Doctors now have better ways to treat brain tumors, like surgery, radiation therapy, chemotherapy, and target therapies. This treatment can make a real difference. Advancements in research. Ongoing research is helping us understand brain tumors better and develop new treatment options. It's like discovering new paths on the road of medical progress. Early detection matters. Catching brain tumors early is key. Regular checkups and paying attention to symptoms like headache, change in vision, or speech problem can lead to earlier diagnosis and better outcomes. Supportive care. Alongside treatments, there are supportive care options to help manage side effects and improve the overall well-being of tumors cancer patients. In a nutshell, don't fall for the myth that brain tumors always mean the end of the road. While they can be challenging, there are treatments that work, research is making progress, and survival rates are improving. It's like finding alternate roads on the journey of life, even when facing a tough challenge like brain cancer tumors. Myth number 4. There's nothing you can do to prevent brain tumors. Have you ever felt like you have no control over whether you might get a brain tumor? Well, it's not like you can't pick your path in life. The truth is, there are some things you can do to lower the risk. It's a bit like steering a ship through rough waters. While you can't avoid all brain tumors, making healthy choices and going for regular checkups can help navigate a bit smoother. So remember, the choices you make can shape your journey. How to lower the risk of brain tumors? Healthy lifestyle. Eating a balanced diet, staying physically active, and not smoking can lower your risk of some types of brain tumors. Regular checkups. Going for regular health checkups can help detect any issues early, which is important for managing your health. Genetic counseling. If you have a family history of brain tumors or other factors that may increase your risk, consider talking to a genetic counselor for a personalized guidance. Avoiding harmful chemicals. Reducing exposure to certain chemicals and toxins in your environment can also be a proactive step. While these measures can lower the risk, it's essential to remember that not all brain tumors can be prevented. But by making healthy choices and being aware of potential risks, you can take charge of your health and steer your journey towards a healthier path. Myth number 5. Brain tumors can only be found in the brain. Have you ever thought that a puzzle is made out of just one piece? Well, think again. It's a bit like believing a story has only one chapter. The truth is, brain tumors can be quite complex. They aren't limited to the brain alone. There's something called brain metastases, which are tumors that travel from other parts of the body and can also affect the brain. It's like discovering that a story has many chapters, each with its own unique perspective. Why brain tumors aren't just in brain? Brain metastases. These are tumors that start in other parts of the body, like the lungs or breast, and then spread to the brain. While they are in the brain, they are still considered brain tumors, but their origin is elsewhere in the body. Complexity of brain tumors. Brain tumors can involve different types of cells and structures within the brain, making them diverse and sometimes challenging to treat. Brain tumors terminologies. The term brain tumors is a generous one that covers tumors that start in the brain and those that spread to the brain from other places. So, it's not only about tumors that begin in the brain itself. Brain tumors can include those that originate elsewhere in the body but make their way to the brain. Brain tumors is an abnormal growth of cells within the brain or the surrounding tissues. These tumors can be either benign, non-cancerous, or malignant cancerous. Brain tumors can originate within the brain itself or spread to the brain from other parts of the body. Cause of brain tumors. The exact cause of brain tumors is often not known. However, there are some risk factors that may increase the likelihood of developing a brain tumor. Radiation exposure. High-dose radiation therapy to the head as a part of previous cancer treatment may increase the risk. Genetics. Some genetic conditions, such as neurofibromatosis and Leukemia syndrome, are associated with an increased risk of brain tumors. Age. Brain tumors can occur at any age, but certain types are more common in children, while others are more frequently diagnosed in adults and the elderly. Common symptoms of brain tumors. The symptoms of a brain tumor can vary depending on its size, location, and types. Common symptoms may include headaches, frequent or severe headaches that may worsen in the morning or with change in position. Seizures, new or worsening seizures which can be a significant symptom. Nausea and vomiting. Nausea and vomiting that may not be related to any other illness. Change in vision, blurred vision, double vision, or vision loss. Balance and coordination problems. Difficulties with balance and coordinations leading to unsteady movements. Personalities and behavioral changes. Unexplained change in behaviors, mood, or personalities. Cognitive changes. Memory problems, difficulties concentrating, and change in cognitive abilities. Weakness or numbness. Weakness or numbness in the limbs, often on one side of the body. Speech problems, difficulty speaking or understanding speech. It's important to note that these symptoms can also be caused by various other medication conditions, and having one or more of these symptoms doesn't necessarily mean you have a brain tumor. However, if you experience persistent or severe symptoms that concern you, it's essential to seek medical evaluation and diagnosis from a healthcare provider. Early detection and treatments can significantly impact the outcome for individuals with brain tumors. Thank you for joining Kim Loh today. Remember to tap the share button to share the light on this debunked myth. Give us a thumbs up if this journey resonates with you. And don't forget to subscribe for more myth-busting exploration.